We're at Haggard Equine Medical Institute, where pharmacist Scarlet Thomas will tell us about equine medications and compounding. When your vet prescribes a medication for your horse, where does it come from?
Well, you have a number of choices. The veterinarians oftentimes will carry commercial products in their car or their truck. They can dispense them from their office. You can also seek out a veterinary pharmacy. The challenge in some cases with human pharmacies is they'll only really have access to human drugs that may also be used in horses. The other option, if it is a compounded medication, you'll have to find a pharmacy that also compounds.
What is compounding?
Compounding has a variety of different definitions depending on who you talk to, but the broadest one, I guess, is altering a medication, a dosage form, mixing products together, changing them such that they're either more palatable, flavorings, different dosage forms. Sometimes not feasible to give 100 tablets of a medication that is really geared for a 150-pound man to a 1,250-pound horse. So oftentimes we have to make unique dosage forms that are more feasibly given to that animal. Also for small animals, cats, dogs, rabbits, lizards, birds, all those kinds of animals, it's not really feasible to give tablets and that type of thing. So we have to use flavorings and any number of tricks to get them to take their medications.
Why is it controversial?
Compounding in recent years has become controversial. I think it used to be, in ancient times, everything was compounded. There were no commercially available products, so pharmacists or apothecaries compounded everything. But as commercial products became more prevalent and more readily available, that went by the wayside, understandably so. Now we have to be very careful where you buy compounded products. You want to make sure that compounds are made by reputable pharmacies that have licensed pharmacists on staff that are licensed with their board of pharmacy. Veterinarians may also legally compound, and that is one of the ways that veterinary compounding originally started, is veterinarians would just kind of compound what they needed based on their population that they were treating. So we have to be very careful that you choose a reputable source. Compounding things that are commercially available, unless you're having to alter them in a different dosage form, is not permissible. So that's another big no-no in compounding. Also, making sure that quality controls exist with your pharmacy, and just know your pharmacist, know the reputation, and be comfortable and feel good about who you're using, that they have a good reputation.
What caution should horse owners take with prescribed medications?
I think you need to, first of all, talk with the veterinarian or with the pharmacist and make sure you understand what you're giving and why. Then you need to understand how often it's to be administered, how it's to be stored. If there are any human precautions, for example, you need to wear gloves when you're administering, or to take care not to inhale the medication if it's a powder form, that type of thing.
If a horse owner has a question about a prescribed medication, where should they go for answers?
The first and best place is always your veterinarian.
That's it for this week's report. Visit thehorse.com for all the latest news on equine healthcare, management, and welfare.